Have you ever wondered why the burnout rate among healthcare workers seems to be astronomically high in the United States? It's a question that's been causing a stir, and for a good reason. The U.S. healthcare system, a colossal machine serving millions, is under tremendous pressure. A pressure that trickles down to the tireless healthcare workers at its core. At the heart of this pressure is a grueling work schedule. Many healthcare workers, from doctors to nurses to technicians, often find themselves working 12-hour shifts, sometimes even longer. Imagine for a second the sheer physical and mental endurance needed to be on your feet, making life-altering decisions for 12 straight hours. Now imagine doing this several times a week, week after week. It's an exhausting reality many in the healthcare field face, and it's taking a toll. This demanding work schedule, coupled with the high-stress nature of the job, is a potent recipe for burnout. Burnout, a state of chronic physical and emotional exhaustion, is alarmingly common among healthcare workers. It's a condition that can lead to decreased productivity, increased medical errors, and can adversely affect the quality of care patients receive. And this isn't just about the long hours. The healthcare system in the United States is constantly being stretched to its limits, operating at near capacity even during non-crisis times. Add a major shock to the system, such as a global pandemic, and the strain on healthcare workers only intensifies. This burnout isn't just about the well-being of healthcare workers, it's about the health of the entire system. A burnt-out healthcare worker can't provide the best care possible, and that affects us all. The burnout rate among healthcare workers is not a problem exclusive to the United States, but it is significantly higher here than in other developed countries. Let's explore why. Just remember, this is not about pointing fingers. It's about understanding the system and finding ways to ease the pressure. Because at the end of the day, a healthier healthcare system means a healthier society. What does the healthcare system look like in other countries, and how does it compare to ours? Let's take a virtual journey across the globe to compare our healthcare system with those in Canada, the United Kingdom, and Australia. These countries, like ours, are industrialized, developed nations, but they approach healthcare in distinct ways that can offer us valuable insights. First stop, Canada. The Canadian healthcare system is publicly funded and mostly free at the point of use. Their healthcare workers, on average, work fewer hours than their counterparts in the United States. This reduction in work hours correlates with lower reported rates of burnout and higher overall job satisfaction. It seems the Canadians are onto something. Next, we head to the United Kingdom. Their National Health Service is one of the largest employers in the world and is renowned for its commitment to employee well-being. A key difference between the healthcare systems in the United States and the United Kingdom is the latter's strong emphasis on work-life balance. They firmly believe that a rested healthcare worker is a more effective one, and their lower burnout rates seem to prove them right. Finally, we travel to Australia, where the healthcare system is a mixed model of public and private providers. Despite the differences in structure, their healthcare workers also work fewer hours than those in the United States, and their burnout rates are considerably lower. But it's not all rosy. These countries also grapple with their unique healthcare challenges. None of them are immune to the strains that come with global health crises like pandemics. However, their approach to the well-being of their healthcare workers seems to create a more resilient system. It's clear that the United States healthcare system operates differently than others around the world. But what are the repercussions of these differences? By examining other healthcare models, we can gain insights into alternative strategies that might help address the burnout crisis in our own healthcare system. Because at the end of the day, a healthy healthcare worker is key to a healthy nation. How does the burnout rate among healthcare workers impact the overall functioning of our healthcare system? This is a question that we need to address urgently. When healthcare workers are squeezed to their limits, the effects ripple out, like a dropped pebble disturbing a calm pond. Burnout is not simply about feeling tired. It's a state of physical, emotional, and mental exhaustion caused by prolonged and excessive stress. Now imagine a doctor, nurse, or technician in that state. Their productivity decreases, they're more prone to making mistakes, and their ability to connect with patients can diminish. This isn't conjecture, it's backed by numerous studies. And these aren't just individual problems, they aggregate and amplify. A decrease in productivity means fewer patients seen, fewer diagnoses made, and fewer treatments administered. Increased mistakes can lead to misdiagnoses, incorrect prescriptions, or even surgical errors. A lack of connection can result in decreased patient satisfaction, which can impact the reputation of the healthcare institution. But the implications go even further. When healthcare workers are burnt out, they're more likely to leave the profession, deepening the capacity constraints of an already stretched thin system. This is not just a theoretical concern. For instance, a global pandemic like the one we experienced recently can shock the system, exacerbating these constraints. During such a crisis, the dominoes start to fall faster. Burnout escalates, mistakes multiply, and capacity constraints tighten, leading to an overburdened healthcare system that struggles to meet the needs of the public. And let's not forget the potential impacts on overall public health. An ineffective healthcare system can lead to delays in diagnoses and treatments, resulting in poorer health outcomes. In a worst-case scenario, it could even contribute to the spread of diseases. The strain on our healthcare workers is not just their problem, it affects us all. So we must prioritize their well-being, not just for their sake, but for the health of our society. It's time we recognize the domino effect of healthcare worker burnout and take steps to prevent it. What changes can we make to improve the situation and reduce burnout among healthcare workers? Ponder on this. The answer lies in reformation, in rethinking the way we approach healthcare work. The 12-hour shift, a standard in many healthcare environments, is one of the main contributors to burnout. It's an intense, grueling marathon that leaves little time for rest or recovery. Imagine a world where these shifts are reduced, where an 8-hour workday becomes the new norm. This change alone could have profound effects. It means less exhaustion, less stress, and more time for healthcare workers to recharge their batteries. But this isn't just about improving conditions for the workers. It's also about enhancing patient care. A well-rested doctor, nurse, or technician is more alert, more focused, and less prone to making mistakes. Of course, reducing shift lengths isn't the only solution. We also need to address the capacity constraints in our healthcare system. How? By investing in training more healthcare workers. This isn't a quick fix, it's a long-term strategy. But the benefits are manifold. By increasing the number of trained professionals, we ease the burden on current staff. We also create a more resilient system, one that is better equipped to handle shocks, be it a sudden influx of patients or a global pandemic. The ripple effects of these changes would be far-reaching. Less burnout means lower turnover rates, which translates to more stability and continuity of care for patients. It also means a healthier, happier workforce, which is crucial for maintaining high-quality care. But let's not forget the human element. Healthcare workers are more than just cogs in a machine. They are people, with lives and dreams outside of their professions. By creating a better work environment, we're not just improving a system, we're improving lives. Change is possible, and it starts with us. It starts with acknowledging the problem, understanding its causes, and taking decisive action to address it. It's time to pave the way for a better future, a future where healthcare workers can thrive, not just survive. How can you contribute to a more sustainable and efficient healthcare system? You may be wondering, what can I, as an individual, do to make a difference? The answer lies in your voice. Your voice is a powerful tool that can influence change. It's not about being a healthcare professional or a policymaker. It's about being a concerned citizen who cares about the well-being of those who work tirelessly to keep us healthy. Think about it. We all rely on the healthcare system at some point in our lives, whether it's for a routine checkup or a life-saving procedure. The people who take care of us during these times are often working long, grueling hours under immense pressure. It's time we advocate for them. Let's start by raising our voices against the standard 12-hour shifts that lead to burnout and decreased productivity. Instead, let's push for shorter, more manageable work hours that allow healthcare workers to rest, recharge, and provide the best care possible. But that's just the beginning. We need to address the capacity constraints in our healthcare system. Too often, our healthcare workers are stretched thin, trying to do more with less. We need to invest in training more healthcare professionals to ensure that our system can handle whatever comes its way, be it the common cold or a global pandemic. Public support can make a world of difference. By voicing our concerns and advocating for change, we can influence policy decisions that lead to significant improvements in our healthcare system. It's about creating a system that values its workers, that understands the importance of their well-being, and that invests in their ongoing development and training. So let's raise our voices. Let's start conversations in our communities. Let's write to our local representatives. Let's use social media to spread the word. Let's do whatever we can to support our healthcare workers and create a better, more sustainable healthcare system. The future of our healthcare system is in our hands. Let's make it a system that supports its workers as much as they support us.